Hi friends, today I will talk about an important emergency drug that is atropine. First is the disclaimer. Caring Doc's YouTube channel does not provide medical advice and information available here does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and the information provided here is not to be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention, and treatment of the medical illness. There is no endorsement for any brand or the company. Coming to the atropine, it is an anticholinergic drug, or we can say muscarinic receptor antagonist, or parasympatholytic. It blocks the parasympathetic or cholinergic system. It has a predominant antimuscarinic effect. That is, it is a competitive antagonist of muscarinic receptors. If we see, the cholinergic system has two types of receptors, nicotinic and muscarinic. Atropine competitively antagonizes the muscarinic receptors as it binds to the muscarinic receptors, and hence the effect of the acetylcholine is blocked, and hence it increases the heart rate. The prominent effects are seen in the organs which normally receive strong parasympathetic nerves. It blocks all subtypes of muscarinic receptors. It also acts as a Mydriatic agent also. If we see the physiological effects of the atropine, on CNS, atropine has a stimulant effect, but at low doses it has a peripheral effect due to limited brain entry. It stimulates various medullary centers, depresses vestibular excitation, and has anti-motion sickness property. Atropine also suppresses the Parkinson's tremors and rigidity. However, high doses can cause cortical excitation, hallucination, delirium, and respiratory depression, leading to coma. On cardiovascular system, atropine's main effect is to increase the heart rate, that is tachycardia, by blocking the M2 receptors on the SA node, reducing the vagal tone. The effect is more pronounced in young adults and less in children and the elderly. It also shortens the refractory period of the AV node and facilitates the conduction. It has no consistent effect on blood pressure. It can increase blood pressure due to tachycardia and vasomotor stimulation, but decreases it due to histamine release and direct vasodilatation at high doses. For eye, the topical installation of atropine causes mydriasis, abolition of the light reflex, and cycloplegia lasting for 7 to 10 days. This results in photophobia and blurring of the near vision. The ciliary muscle recovers somewhat earlier than the sphincter pupillae. It also increases the intraocular tension, so it is contraindicated in narrow angle glaucoma. In smooth muscles, atropine relaxes the visceral smooth muscles with parasympathetic innervation. It reduces the stomach and the intestinal contraction, slowing of the chyme and potentially causes constipation. It relaxes the bronchial muscles, reducing the airway resistance in COPD and asthma. It attenuates the inflammatory mediators effects on the vagal activity. It relaxes the ureter and urinary bladder and potentially causing the urinary retention, especially in the elderly with benign prostatic hyperplasia. It has a minimal effect on the biliary tract and the uterus. In various glands, it decreases the secretion. For example, in the sweat gland, saliva, tracheobronchial, lacrimal, and gastric acid secretions. It causes dryness of the skin and the eyes, and it causes difficulty in talking and the swallowing. It also increases the body temperature at high doses, especially in the children. It has a mild local anesthetic effect on the cornea. It enhances the acetylcholine release from the certain nerve endings, producing the paradoxical responses. Sensitivity to atropine varies among the organs and the tissue, with salivary and the sweat glands being most sensitive. Atropine is available as an injection, eye drop, and ointment. Injection is available as ampule and vial. 1 ml ampule is 0.6 mg per ml of the atropine sulfate, and in children the dose is 10 microgram per kg. 100 mg of vial also contains 1 mg per ml of the atropine. Half-life of the atropine is 3 to 4 hours. Onset of the action depends upon the route of administration. In intramuscular route, the onset of action is less than 15 to 30 minutes. For IV use, it's immediate. About 50% of the atropine is metabolized in the liver and the rest is excreted unchanged in the urine. So the dose of the atropine is available as 0.6 to 2 milligram IM or IV. When it is applied to the eye, it freely penetrates the cornea and passage across the blood-brain barrier is somewhat restricted. It is used as a 1% eye drop as ointment or at times 5% eye ointment. Coming to the uses of the atropine, it is used in symptomatic bradycardia with symptoms like chest pain, shock, altered sensorium, and cardiac failure. The dose in symptomatic bradycardia is for adults it is 1 milligram IV bolus. Repeat it every 3 to 5 minutes. Maximum dose is 3 milligram. For pediatric patient it is 0.02 milligram per kg through IV route, intraosseous route, or endotracheal tube. For endotracheal tube, the dose is 3 times of the normal dose. In special consideration, it is not effective in heart transplant patients, type 2 second degree heart block or third degree heart block. It is not recommended for asystole or pulseless electrical activity because atropine increases the heart rate by accelerating the sinus and the atrial pacemakers and improving the AV node conduction. Tachycardia is the primary effect, but the heart rate may transiently decrease with small doses due to increased acetylcholine. So its administration as IV or intraosseous dose is 0.02 milligram per kg and maximum is the 1 milligram single dose. Whenever we prepare the patient, we have to administer atropine while preparing for the cardiac pacing of the patient. For example, transvenous or transcutaneous, or when the chronotropic agent infusion is being started in bradycardia patients with high vagal tone, for example, in inferior myocardial ischemia, medication induced bradycardia, that is high level of beta blockers, calcium channel blockers, other digitalis, or high degree AV blocks with normal QRS complexes. Avoid atropine if patient has a wide QRX and move directly to the pacing or the chronotropic agents. It is also used as an antisecretory agents in a dose of 0.5 to 1 milligram, which is to be repeated every 4 to 6 hours. Some anesthetic agents, they increase the secretion, though the glycopyrrolate is preferred over there, but atropine can be used in life-threatening conditions. It is also used in countering the paralytic effects of the certain agents. For example, it reverses the effect of anticholinergic inhibitors like neostigmine, physostigmine, which increases the acetylcholine and parasympathetic activity. Dose is 1 to 2 milligram IV push. It is also used in organophosphate or carbamate poisoning, such as these are insecticide or we can say they are nerve agents. The initial dose is 1 to 2 milligram IV bolus. Repeat every 5 minutes, doubling the dose until bronchoria or bronchospasm are resolved. For continuous infusion, the dose is 10 to 20% of the total bolus per hour. In organophosphate poisoning or the carbamate poisoning, it can be used in field also. The atropine auto injectors are available. It can be given as 2 milligram intramuscular and maximum of 3 doses can be given. When it is used as IV, we have to give as a dose of 2 to 5 milligram and doubling the dose every 3 to 5 minutes. And in severe cases, the dose up to 100 milligram of IV can be used. It is also used in mushroom poisoning as a dose of 1 to 2 milligram and we can repeat that also. It is also used in inflammatory condition of the eyes like iritis, choroiditis, iridocyclitis. It is used as a drops, eye ointment, as 5% ointment, 1% eye drops, and as it has a longer duration of action. It is contraindicated in patients with narrow angle glaucoma because it increases the intraocular pressure. Side effects of the atropines are opposite to that of acetylcholine. In CNS, it stimulates the CNS. Patient gets excited, agitated, disoriented, hallucinated, headache, dyspnea, nausea, vomiting, delirium, Seizure, agitation, amnesia, anxiety, confusion, ataxia, and coma are common. In CVS, patient may have atrial or ventricular arrhythmias, fibrillation, AV dissociation, flushing, tachycardia, bradycardia, and low doses, and palpitation. In the eyes, it causes mydriasis, cycloplegia, photophobia, abnormal eye movement, blindness, blurring of the vision, and it relaxes the smooth muscle, precipitates the acute angle glaucoma. In GIT, it has a effect as vomiting and the constipation. It also causes bronchodilation, plug formation in chronic lung diseases. In genitourinary tract, it causes urinary retention because of the relaxation of the smooth muscle. So we have to be cautious while using it in patients with BPH. It causes anhidrosis in skin, dryness of the skin, rashes, increased temperature, that is hyperthermia, due to decreased secretion of the sweat glands. We should not use in CKD patient as it aggravates the renal impairment. It precipitates the myasthenia gravis crisis also, and at times it can cause psychosis. On blood, it causes leukocytosis. There may be increased or decreased hemoglobin and abnormal erythrocytosis. Metabolic effects are dehydration, hyper or hypoglycemia, hypokalemia, hyponatremia, and increased thirst. It decreases the secretion of the salivary and the sweat glands. It causes muscle twitching, muscle weakness, and in some patients there may be hypersensitivity reaction, and patient may have hyperthermia, especially in the children's. With this, I conclude my this topic on atropine. William Osler has said, medicine is a science of uncertainty and art of probability. I hope you will like this video. Thank you very much.